This is Kupuna Connections, brought to you by Kapi'olani Community College's Kupuna Education Center.
Welcome to the Kupuna Connections television show. I am Cullen Hayashida, and with me is my co-host, Toni Hathaway, and we're both with Kapiolani Community College, Kupuna Education Center. The Kupuna Connections TV program is a broadcast that is shown statewide from Kauai to the Big Island, and we're providing very practical information basically for families and for the elderly and for family caregivers about how to care for our seniors in their later years. Today we're going to be talking about normal aging. What is normal aging? And with us is a very special guest. We've got Valisa Saunders. Valisa Saunders is a longtime geriatrician, and not geriatrician, but geriatric nurse practitioner and a real leader in the field of nursing in Hawaii. Welcome, Valisa.
Thank you.
So, Valisa, can you share a little bit about who you are and what do you do?
Sure. I am a geriatric nurse practitioner. I work at Kaiser Permanente, and I'm based in the outpatient arena. I see patients, the frailest elderly patients in the outpatient setting, as well as we do home visits, hospice at home, and I also do long-term care patients, Kaiser patients.
Okay. Let's see, we said that we're going to be talking about normal aging, and of course that is a pretty broad term, but could you kind of give us an idea what this is all about? What is normal aging?
Okay, well, normal aging is a part of our lifespan that we don't always necessarily look forward to, but there are a number of changes that do start occurring. We don't just, unfortunately, we don't just live a long life and suddenly die in our sleep. There are changes that start occurring maybe even in our 30s. I think when we're 30, we're at our peak, and kind of the late 30s, a lot of us start noticing changes. And one of the most observable changes we start looking at are skin changes, especially in Hawaii, where we've been exposed to a lot of sun, and we didn't know about sunscreens when we were younger. And we lose elasticity in the skin. The skin thins with a lot of exposure. We develop wrinkles, and our hair may turn gray. Fortunately, mine hasn't. So that's the most observable one.
Okay.
There are also things happening more internally, and probably somewhere around 40, most of us notice, if we've never worn glasses before, that suddenly we need the paper further and further away from us, we have noticed. So there's some, and that's because the muscles and the lens in the eye become more rigid. And that's kind of a key concept. That kind of rigidity, loss of elasticity, loss of flexibility, that's something that's really happening in many parts of the body.
And I guess we lose our teeth, or and there are problems with our dentures as well.
Well, fortunately, that's an area that a lot of progress has been made. When I was a registered nurse, my first year in nursing, working in a nursing home in Eastern Washington, probably almost all of our patients had dentures. They didn't have any teeth because the solution used to be pull teeth. And that's really not a great idea. When we do have a lot more restorative dentistry now, the baby boomers went through a lot of restorative dentistry for not so great teeth. But as time has gone on, we've also gotten more preventive care, and the children now coming up, a lot of them don't have any cavities if they've gotten the fluoride treatments that they should with pregnancy, starting with when they were in the womb, and then as children, vitamins with fluoride, and many of them don't have any cavities, but they can still suffer gum disease. So that's an area that's a very preventable area, and I do have many patients with most of their teeth. Maybe they have a few missing molars. So that's the good news, because there's a lot of important functions for the teeth. And when you lose teeth, you lose bone, you resorb bone, and then you may have dentures, but after a while they don't fit as well. So it can become very debilitating in terms of getting proper nutrition as we age. So teeth are very important.
So now, as far as then normal aging is concerned, we can expect to start to lose some of our physical abilities. That should be expected.
It it happens. I think there's a lot of things we can do to maximize our function, but yes, there are changes that may be beyond our control. We may be able to optimize our functioning, but we can't really stop aging altogether, at least not at this point.
Well, you know, it's assumed that we are not planning to live forever, and you know, that's
At this time.
At this time, right.
Right. Well, how about if we switch and talk about some of the abnormal changes with aging, some of the disease processes and things that happen not to all of us, but to many of us.
And probably most of the people that I see, the abnormal changes really can cause a lot of significant disability and mortality. The one I think of first and foremost, of course, is dementia, which there's a lot of confusion about what that means. And some people say, well, it's just a little bit dementia now, but then it becomes Alzheimer's later. But dementia is just a global term, meaning there's some kind of cognitive impairment, and that's really not a specific diagnosis. Alzheimer's is more and more common as we age. So by the time somebody's 85, they have almost a 50% chance of having some type of irreversible dementia, which really can impair their life in terms of function and quality. And a large percent of those are Alzheimer's disease. And then there's a lot of vascular dementia. And a little less commonly is the dementia associated with Parkinson's disease, frontotemporal dementias, Huntington's chorea, very, very rare, but it does occur.
So does that mean, though, that if there is more of this occurring at later age, that one should expect that and that should be considered to be normal?
I wouldn't want to just assume that it's normal, because there may be something else going on that we can actually treat. So I always tell people, no, it's not normal that someone is losing their memory. It's something that really needs to be evaluated as a medical problem, and to check and make sure it's not a thyroid disorder, a vitamin deficiency, some kind of tumor, or other diseases that could mimic a dementia. Also, depression can masquerade as a dementia. I've seen this a number of times where people are assumed to be demented, but they're really depressed. And when you treat the depression, their memory gets a lot better. Okay? That it may be the heralding of a very early dementia, but we shouldn't assume that, because we can maximize function by treating those things. Some of the other diseases that really are abnormal aging is COPD, chronic obstructive pulmonary disease, lung disease, can significantly impair your function and your quality of life, and I don't consider that a typical normal thing. We do lose some capacity in terms of the respiratory system, but these diseases, and sometimes they do occur in the absence of smoking, but the most severe is really, of course, with smoking. Atherosclerosis, you know, the collection of plaques or hardening of the arteries is kind of commonly how we think of it, you know, damages all of the organs. People think of, oh, it's just the heart, you know, my cholesterol's high and I'm going to have a heart attack and I'll just die. Well, no, it really affects all of the organs. It affects the brain, it affects the kidneys, it affects everything.
You know, I remember once when we visited a physician for my grandmother, and the physician said, "What do you expect? She's old." You know, so I think what you're saying is, let's not give up and just assume that nothing, the implication is nothing can be done, you know. But I guess what you're saying is, let's not assume that nothing can be done, and let's see whether or not there can be a way to reverse it, and it may be abnormal in that sense.
Reverse it, or slow down the progress, or, you know, treat some of the risk factors, and there are some other things. I mean, you know, in fact, it was my own father who died of Alzheimer's disease early on when I noticed that, and I talked to him about it, and he really had some understanding about this. Well, what can we do? So, well, you know, there are some medications that can slow it down, and one of the most important things is to do some planning, and you need to do it very soon, because once the disease progresses, you lose the capacity to do that kind of planning. It's very important to do that.
Okay.
So that's a good example of some of the things you can do once you know you have something. Are there any things we can do to prevent some of these conditions?
Well, it comes down to lifestyle. We may not be able to. Some of these may be genetic things that we don't even understand. There may be more classes of dementias than we really actually know at this time. We don't have really blood tests for any of these dementias at this time. But we do know there's a lot of we see a lot more vascular dementia now, not because it's probably more prevalent, but probably because we do CAT scans on everybody.
And what's vascular dementia?
Well, that's really where there's this small vessel disease. And you know with diabetics that they're having small vessel disease, most people are familiar with that. That's why they get peripheral neuropathy. And that's why they also, their kidneys become damaged. That same damage is happening in the brain. And it turns out diabetics have a much higher incidence of dementia. And it's from this vascular problem. So treating the risk factors for vascular disease, high cholesterol, keep diabetes controlled, exercise, those are things that may be able to prevent or slow down the progression of those diseases.
Now, one of the things that you hear oftentimes in the research literature is that you've got to remain, let's say, healthy in one's older age. You've got to exercise, or you've got to eat a balanced diet, or got to be socially involved, or don't drink too much, or drink in moderation, and not smoke, and that sort of thing. How much truth is in all of that?
Well, certainly we always find the exceptions, right? The 99-year-old that's been smoking and drinking forever, but the truth is most of the really advanced, the centenarians that I see don't drink, they never smoked, they're thin, they're never overweight.
Never overweight. Yeah.
And it is a lifestyle issue. And smoking is a big, it's one of the biggest, and that also causes a lot of vascular damage. People think of just the lungs and cancer, but it also causes significant vascular problems that can be avoided by not smoking. And I know that's a tall order for someone that's habituated to cigarettes, but it's very important to approach that.
So how do all of these things apply to Hawaii's retirees, you think?
Well, there's very little excuse to not do some kind of physical activity, because the weather's good. Although people say, well, I don't want to be out in the sun, I'll get skin cancer. There's some truth to that. But we do want to go early in the morning. So I swim in the ocean, so we go early in the morning. Walking in the mall is a good thing. But the climate is very conducive to that. There's a lot of things to do in the parks, in the malls, classes around the community. And it is, activity and exercise is very important if you're able to do that. I mean, sometimes we develop disabilities or diseases as we age that really make that very, very difficult, such as arthritis. If your knees don't work, it's very hard to walk very, very far. So we have to really be sensitive to what are the abilities of this person and how can we maximize their function. It has to be a very individualized plan, and don't assume the same thing is good for everybody.
Well, we've talked about a number of different medical conditions, things like diabetes, arthritis, Alzheimer's, osteoporosis. If we're helping to take care of an elderly person, what kinds of things should we be on the lookout to if they have these conditions, or to help them?
Looking for a change in condition. If there's really a significant change in their function, they're suddenly very confused compared to yesterday. They're suddenly not knowing where they are, or they're not eating very well, losing weight, falling down. That's a big one. Yeah. Are they falling down? Why are they falling down? That's really needs to be investigated. Mm-hmm. So really being in tune to those changes. And when you do see those kind of changes, they really need a medical evaluation. It can be just a progression of their chronic disease or their dementia, but it could be something very treatable. It could be a urinary tract infection, and we see urinary tract infections present in many different ways, things you would never imagine.
What do you mean by that? I mean, many different ways.
Well, for a younger adult, you expect, if you have a urinary tract infection, you have pain.
Okay.
Well, older patients, older adults, especially if they have memory impairment, may not be perceiving pain like you or I do anymore. They may just become confused, not want to eat, become incontinent suddenly. Those are things that are changes that were not normal for them yesterday. So those are signs that they may have a urinary tract infection, and they will never complain of pain.
So you shouldn't just ignore things. You should go ahead and follow up and have it checked out.
Right.
So hopefully the senior themselves would be aware of these changes and take the initiative and go to the physician and actually and
And
see
most
whether
people
that's
will.
something. Yeah.
But again, when someone becomes demented, you know, memory problems, and they
Right.
don't have the insight and judgment anymore, they won't report their symptoms. They underreport their symptoms. And we talked about falls, and I've seen a number of cases where they were, they're falling, and they just think, well, they're just getting old. What do you expect? Well, they come in with the broken hip, and actually they have a pneumonia that has been brewing for some time. So when people are falling, it's just not a matter of getting back up on your feet. Why is this person suddenly falling? What's the reason for it? It really should be investigated.
Oh, good point. Yes. Okay.
So the other thing I want to say about in that area is, a certain amount of self-care is good. We should take responsibility for our health, read about things, get advice. But with the elderly, we need to be particularly careful about using over-the-counter medications. Again, someone with some dementia, or maybe they don't have any identifiable memory problems, but as they become more frail, a little less reserved, and they take things over the counter, particularly cold medicines, Benadryl, which is people are using for sleep. It's in Tylenol PM, it's in Aleve PM.
Right.
Fine for a younger person, it's great for drug reactions, but it can make an older person very confused, make them fall, drop their blood pressure. It can cause constipation, dry mouth, blurry vision, even hallucinations.
All that
Wow.
I've seen it all.
Yeah.
with over-the-counter.
With over-the-counter medications, which are, quote-unquote, safe.
Right.
Yeah.
And oftentimes we have people taking multiple medications, and the more you take, of course.
They take something, they get a side effect, they get another medication. And we've seen people come in we ask them in our geriatric clinic, we actually call before the appointments and say, please bring in all your medications, including your over-the-counter medications.
Right.
We have some interesting pictures. Lots and lots of supplements and lots of old bottles. I mean, usually they won't bring all of them in if there's a lot of old bottles, but if you go out on a home visit, just amazing what you will find in some of these cupboards.
And people will not even throw those old ones away.
They don't want to throw anything away.
Right.
They might need it someday.
They might need it sometime, So the next thing you know, they've got 10 as needed pain medications, really old antibiotics, which really should be thrown away. So that can be very dangerous. And I'll tell you, I've had a number of cases where we thought we had an older person dying. Well, we're all dying, but we thought they were actively dying. So we talked about transitioning to hospice and comfort care and stopped all of their oral medications because it became dangerous for them to swallow anymore. They might aspirate. And sometimes they wake up.
They got better. Yeah.
Really, it really happens.
You can get drunk on drugs, huh?
You can be very debilitated with all
Yeah,
those.
no, I've seen this too with older folks. It's almost miraculous when they're taken off whatever combination or one medication it might be, and they become totally alert and fine.
Yeah.
You know what I guess is of concern here with regards to the medication piece is that they go to, the seniors are going to multiple doctors. And the doctors are not talking to each other oftentimes. I don't know. Well, perhaps in Kaiser,
Even
that's
if
a
they
little
are.
Even if they are.
Yeah. No, that's a good point. But let me explain it. Kaiser has this electronic medical record. It's statewide. We can see everything that's been ordered.
That's been ordered.
And people think, well, the neurologist may start something new, or they may change the dose, but maybe they don't change it in the computer yet because they're not sure how it's going to work, or for some reason the list keeps growing. And most of my patients do think, well, it's in the computer. I ask them what they're taking, and it's in the record. Isn't it in my record? So, well, I do know everything that's been ordered, but I really don't know what you're taking until you tell me that you're taking it. And that's, especially, we have a program for post-hospital home visits, which we also do in my department. And the hospital sends them out with a list, but they go home and they are not sure whether they're supposed to resume this other one, or maybe the dose, it's the same medication, but it's a different dose. And one of the big things we do after the hospital stay, even for our own patients, is the medication reconciliation. It's a very, very big issue, and it needs a lot more attention, but it's really not, until we have webcams and see what they do at home, we really don't know what they're taking.
Would you like to explain what reconciliation with medication is?
If we have two different lists, one's from the hospital, which is not on the same electronic record, although they can look at ours, but they don't know it as well. They'll be going up sometime later this year. But the outpatient medical electronic medical record, there's two different lists. And like I say, one's open orders, and then one's this list that came from the hospital. So do they fit together or don't they? And so that's something you have to go through and spend a lot of time really looking at. Are they taking the right medications? Or did they have these medications before and they weren't taking them, which nobody knew? This happens a lot with our patients. So they get to the hospital and they see their list of what they were taking, and they order the same thing in the hospital, and the next thing you know, their blood pressure is bottomed out and they're falling down because now they're taking too much. The doctor didn't know they weren't taking the blood pressure medicine, so they kept upping the dose. Okay, but they never took it. So you get to the hospital and you give them the full dose that was ordered, and it's not good.
Wow, just all kinds of problems with
Yeah.
that.
So
Can happen, huh?
medication safety issues are huge
Yeah.
with the elderly, and that's where, again, once the memory starts failing, and they'll come in and tell you, yes, I'm taking this, and they'll tell the family they're taking it, and I call them up and they'll tell me, yeah, it's on the list, they're taking it. And I say, can you go get the bottle and tell me how many pills are in that bottle, or this is something we'll do at home. And they filled it last July and it's never been refilled.
I wanted to just switch to a new topic.
Okay.
And that is, we see all kinds of advertisements for anti-aging pills and lotions and treatments. What do you think of those?
You can waste a lot of money. Like I said, I think lifestyle issues, healthy living is the most important. Treat your blood pressure, that's very important. There are some over-the-counter supplements that are important, but you still need to get advice from your healthcare provider about which ones are appropriate for you. Most older women need supplemental calcium and vitamin D. It turns out that's probably true for a lot of men as well. But beyond that, I think we need to be very careful about buying more and more supplements. That marketing and advertising for these supplements is tremendous. And people do spend a lot of money on it, sometimes at the expense of really maybe something else that they need.
It's a lot of money, and you can go to, pharmacy, and they just have all these, not just necessarily medications, but all these minerals and all these combinations, and the cost is extremely high.
Yeah. It'd be better to spend your money on good food. Lots of fruits and vegetables, and the healthy, balanced diet is very important. So, yeah, I have a lot of concerns about.
So if people, oftentimes the seniors will get an advice from another person, right? So what's your advice? To tell them to go ahead and talk to the healthcare professionals, but they may be a little bit embarrassed, perhaps. But perhaps that's a good advice.
Well, that's up to the providers. We really need to develop a climate where they can be honest and not be scolded and not be blamed, but just give them honest and open information and recommendations.
Okay. One of the things that I wanted to just show by way of PowerPoint is this slide that you provided us with, and it has to do with what is healthy aging and the goal of healthy aging, and this is something that we're trying to achieve, for all of us. Can you explain something about this?
Okay. Well, we're looking at this graph for goal of healthy aging. I think, like many of my patients tell me, they think that they're going to go along and they're going to live their life, and then one night they're just going to go to sleep. As you've got the age along the bottom, and the section D is where we become independent, and this is really referring to activities of daily living, primarily, by age 10. But we decline in function over time, and then we see by age 80 there's a lot of deficiencies in activities of daily living. But we'd like to be able to have people live more independently and functional by correcting as many of the problems we're aware of as possible so that we live our full life and just go to sleep die in our sleep.
And this is possible, perhaps, and not need long-term care, perhaps.
That would be
That would be-
everybody's goal.
Yeah.
Yeah, maybe
Okay.
put me out of business in my clinic, that would be a great goal.
That would be yeah. Well, okay. That's a good goal for all of us, I think, in terms of healthy aging, positive aging, successful aging, and we hear a number of different kinds of terms. But this is not anti-aging. I think it's recognizing that we do have an end of life, but that we try to live as independently as long as possible, right? So let's say if we had one more recommendation that you wanted to provide to our viewers out there, putting all this information together, and you wanted our viewers to remember one thing from Valisa Saunders.
Okay. I'd like to give you all some sage advice.
Sage advice. This is very powerful.
So this is an acronym.
Okay.
If you haven't already, S, stop smoking. Smoking really makes you a slave. It costs money. It does a lot of damage to your lungs and your blood vessels. Okay. Secondly, A, advanced healthcare directives. We really need to take the time to execute an advanced healthcare directive that tells our loved ones how we want to live. I don't want to say end, but live our lives in our older years and how we prefer to die, so that people have self-determination about that when they're no longer able. G, this may be very controversial, but because of my experience with the elderly, get out of your big house by the time you're around 75. Okay, 65 I think is a little too young. You're going to lose some equity advantages. Assisted living is just great. People, I think it's overrated to say, I'm going to die in my own house. This is where I lived all these years. I built my house, and I'm going to stay here. But people don't always thrive that well in that situation. Yeah. And then E, as to the fullest that you can, exercise, stay active. And that means not only physically, but in your mind.
Well, someone had said that if exercise could be put into the pill, that's probably the best medicine that
that really would be.
Yeah?
Absolutely.
Okay, so thank you so much, Valisa. You've been a wonderful guest for this
Thank you very much for having me. Enjoy.
Yes. So this is the end of our program. This is, again, the Kupuna Connections television show, and thank you very much for being with us today, and hope to see you again next week. Aloha.
For more information about training and educational opportunities, please contact your local community college's continuing education program or Kapi'olani Community College's Kupuna Education Center, 734-9108. Mahalo, and thank you for watching Kupuna Connections.